Our next speaker is Dr. Gerry Clausen, and I don't have an introduction there for him because he said he doesn't need it. But look, Gerry has an outstanding career. He has been a clinico-legal advisor at MIPS for a number of years now. He is going all around the world doing presentations and providing education, so I'm sure you'll really enjoy his presentation. What he's going to talk about today is really going to give you an insight into the Australian dental scene, and obviously some of the risks that he sees from where he sits and a number of risk management strategies. So I'll hand you over to Gerry.
Thanks, Doug. Ladies and gentlemen, I'm a specialist prosthodontist too. I've been in prosthodontic practice since 1983. I'm the current Secretary-Treasurer of the Academy of Prosthodontists in Australia, and I've been teaching at university for the last quarter of a century or so, so I've done a few miles around the traps. I've sort of got the job of speaking to you tonight in between Jeff and David, and what we intended was that Jeff would sort of look at some clinical issues, which he has, and David is going to look at things from more a legal perspective, which is important too. And what I'm going to do is sort of tie that together with, I guess, the sort of understanding of where the scene's at the moment, and also very briefly three specific issues: records, contracts and risk, that I think are important. What I'm going to do first of all, though, is just talk to you about the overall scene, because as I was saying to one of our friends this evening, a lot of us are in practice in our little practices, and we work every day and we're kings in our little castle. But we just don't realise what happens in the big world there. You know, in dentistry, for example, we look at dentistry as important because we're dentists, and it's important to us, and we believe that it's an important profession. There are all over 18,000 dentists in Australia. There are nearly 12,000 psychologists just in Victoria. In APRA, which includes the medical board, physiotherapists, psychologists and similar, there are 520,000 healthcare providers. Can you understand how insignificant dentistry is? You know, in terms of 18 or 20,000 in 500. So a lot of the time when we think, you know, dentistry is a big issue and it's a major thing and it's a big area, it's, you know, the Association of Stamp Collectors probably outnumbers us about 20 to 1. So please understand that, because, you know, we need to know where things are coming from. And dentistry's changing too, you know, I mean, a lot of the demographic and the makeup of practitioners is changing, but one of the things that is changing for us is an increasing number of non-clinical indemnity claims. Many people sit down and say, but I'm a good dentist, I practice good dentistry, I try and do the best technical dentistry, I go to endodontic courses, prosthodontic courses, I learn how to do things well, I will never have a claim because I do good technical dentistry. The nature of claims is changing. Often the technical aspect is good, it's the other aspects that are causing problems. And this is why people get so disconcerted when a claim comes up. But I'm a good dentist. How can I have a claim against me? That's exactly where it's going. So let's think about some of these things as we talk. What is changing in the workforce at the moment? Well, for a start, we've got an expanding Australian dental scene. You know, we've got nearly double the number of dental schools that there were only a few years ago. We've got increased numbers of students at each school. For example, in Melbourne, we've got nearly double the number of undergraduates. We have a 4- or 5-fold increase in overseas trained graduates who are sitting their ADC exams and are being registered. There is an enormous explosion, whether you like it or not, enormous explosion in the dental workforce. Now, as an aside, I was giving a lecture in Thredbo in August last year, and it's a pretty boring place unless you go skiing, which I don't. So I was sitting around there in the bar, and I was reading a book from 1955, and it was Who's Who in Australia. And it was quite interesting because my grandfather was the Deputy Crown Solicitor of Victoria, so I was looking up his CV. And I also looked up the population of Australia in 1955. It was just under 12 million people. Now, you might have noticed the population of Australia has just ticked over 23 million recently. Now, you can do the mathematics for me. It's taken nearly 60 years for the population to double, all right? Can you see it isn't going to take 60 years for the number of dentists to double? So, you know, whether more people go to the dentist or less people, we have an enormous change in the percentage of dentists to the population, which means it's getting a lot tougher out there. And any person, you know, that you know in dentistry, when you talk to them after a drink or two, they sit down and say, yeah, man, it's hard. It's getting harder. After 3 or 4 beers, they say it's getting very hard. All right? So, you know, the world is changing. Dentistry isn't a guaranteed income. And again, what I would say to you, look, let's cut all the figures and similar. Let's cut the bottom line. The overall number of oral health practitioners, and again you say, oh yes, but that includes therapists, hygienists and similar. We are all oral health practitioners. And the scope of practice for technicians, for therapists, for hygienists is expanding every day. So, you know, if you're a dentist and you think, yes, but this doesn't apply to me, this only applies to those other people, then you'd better rethink your ideas. But it's expected to increase by 50% up to 2025. Now, by my mathematics, that's only about 12 years off. And again, mathematically, we are not going to see the population increase by that amount in that period of time. Yep. So there is a big change, a big change in the dentist or the oral health care provider to practitioner ratio, no matter which way you look at it. No matter which way you look at it. And again, you know, between 2002 and 2013, roughly 10 years, you know, the number of new dentists per annum has basically doubled, and that's going to continue. That's not going to change. They're not going to shut down dental schools. They're not going to put out less graduates. You can't do that because once you have a school up and going, you need to keep on putting people out. So this will continue. This is not a static thing. The other thing is we've got to be realistic. You might sit down and say, but we've got all these new dental schools and we've got lovely tools and toys. I spent yesterday at Motec running a pre-congress course with 8 other prosthodontists, a hands-on course with all of the lovely tools and computers and simulated models and everything else. And you would sit down and say, I guess people are getting trained better though, and we are technically doing better dentistry than before. The reality is, you know, if we look at this from the Sydney Morning Herald, dentists fail their final exams at a rate more than 10 times higher than that of medical students, but they eventually pass. Why? Because you can't afford to keep them back for another year. So you're going to pass whether you like it or not. We're going to get you out of here, baby. You know, 1 in 7 couldn't graduate and had to take up remedial learning and think, wow, what did that mean? Did they have to do another 3 years of the course? No, they did a 3-week semester break and just picked it up and out they went. Now, you know, again, there's an old saying, you know, the older I get, the better I was. And everybody that's older always says, in my day, we used to have to do this, that, you know, oh, tell me about it, I couldn't care less. But the reality is, standards are changing, technical excellence is changing, and the standards of treatment are changing. So we've got a change in population, dentist population, we've got a change in standards, in sort of training and education. And as well, we've got a change in the real world population. Now, you know, Julia Gillard couldn't pay to get her face on the front of Saturday's edition of the Sydney Morning Herald. That is like a serious newspaper, right? You don't get in the front page. A dentist can. So when a dentist can make it to the front page of the Sydney Morning Herald, the world's changing. Can you get the feeling from this? You know, what's the feeling you get when you read it? Complaints have more than trebled in 3 years. But from 661 complaints, only 14 dentists have been disciplined. What are they saying? You're too lenient on them. They're nasty. They're bad. We should punish them. One was deregistered. Oh, terrible. Do you understand that the sort of public sentiment is changing too, and where people perhaps 5, 10, 15 years ago may not have complained, may not have bothered, people are willing to complain, they're keen to complain, they want their pound of flesh and they want to see something done about it. And unless you understand that, you know, again, and this is what risk management, this is what serious risk management is about. Understanding what the risks are. You can't blithely jump through your dental practice and think, oh, nothing's going to be a bother because patients love me, everybody's happy, there are no technical risks. It is getting a little ugly and the world is changing out there, so you need to be aware of it. And again, and I think David's going to talk about this later on in more detail, but, you know, why is this so? Because, man, when there's 28 RCTs and crowns that failed and the sum awarded is $1.75 million, that's a big drink. That'll pay for a lot of lawyers, that'll pay for a lot of other people. That's a big field day for everybody. And this is, you know, this is where things are going. So you need to be familiar with this, you need to understand this. And you need to recognise that the dental world is becoming a tougher, a more competitive and a more complaint-prone zone. The things you might have done before that didn't matter, the things that people wouldn't complain about, the things that you would have said, hey, she'll be right, you know, I'll do a free filling for you and that'll be okay, it's not going to happen these days. It's not going to happen. That's the key strategy I want you to think about. And it's not to scare you because really, I'm not here to scare you, and if I want to scare you, I can really scare you. I'm here to educate you. And I believe that educated people are, first of all, the ones that understand the risk, because if you understand it, you're less likely to get into it. That's the key element. Execution. Jeff spoke a little bit about technical competence. Clearly, everybody makes mistakes and you can forgive that. But if you're incompetent and you stuff things up, then it's going to cost money. So you need to be strong enough, smart enough and reasonable enough to say, what do I know, what don't I know, what can I do, what can't I do, and stick to what you can do. You won't find too many prosthodontists that sit down and do surgical extraction of third molars. Why not? They don't know what they're doing. Have a good hard look at yourself and say, what do I really enjoy, what do I like and what do I know about? And you might do better to confine yourself to that sort of area.